Welcome to our latest episode of Wellbeing Wednesdays, the National Council's virtual series on healthcare. In this episode, Chuck Ingolia, President and CEO of the National Council for Mental Wellbeing, sits down with New York Times bestselling author of Dopesick and Raising Lazarus, Beth Macy, to discuss the opioid crisis, harm reduction, and the important work of peer support specialists. Now, please welcome National Council CEO Chuck Ingolia.
I'm honored to be joined today by best-selling author Beth Macy, who has produced some of the best nonfiction ever written on the opioid crisis in America that has helped so many of us understand the scope and scale of this epidemic. Her first book, Dopesick, was published in 2018 and adapted for television. You can see it on Hulu. And Raising Lazarus was published in 2022. Welcome, and thank you for taking a few minutes today to share your thoughts with our members and so many others in the field about substance use, and especially the opioid epidemic. Welcome, Beth.
Thank you. It's great to be here.
So I have to admit, I found Dopesick really hard to read and even to watch because I knew the outcome. And it was just so hard to be reminded of that. But Raising Lazarus was just such an inspirational book. I'm just curious, could you help us understand a little bit, like, how did you get interested in this topic and what continues to motivate you?
Yeah, thanks. That's a great question. I was a newspaper reporter at the Roanoke Times in Virginia for, 25 years, and quit in 2014 when my first book, Factory Man, came out. But one of the last stories I did for the paper was back in 2012, and it was a series about the fact that this upper middle class suburb was rife with heroin addiction. And it made big news because these two families' lives had been upended. One, the young gentleman had died, and the other, the young gentleman, his former private school classmate, was about to go to federal prison for 5.5 years because he had sold him the heroin that resulted in the death. And it was a powerful series. I mean, we didn't have a lot of hopes for it. We wanted to just let the community, put them on alert that this was happening. And if they had these extra meds, which is how a lot of kids got started, taking excess opioids left over from their parents' and grandparents' surgeries and whatnot, just experimenting. And we wanted to really show how dangerous that was. And then I knew it didn't go away, and so I'd actually proposed Dopesick to be my second book. It was actually my third, but I couldn't really convince my gatekeepers in New York, my agent, my editor, that we were really in the middle part of a full-blown epidemic, and nobody knew it really until the economists told us that our life expectancy was going down for the first time since World War I. And then I was able to go back later and say, hey, I knew this wasn't going away, because I remember those two kids, when the cops finally got the one that was arrested, they were using and dealing with 50 different kids. And I knew it wasn't something that just went away. I mean, we know now it takes an average of 8 years, 4 to 5 treatment attempts just to get 1 year of sobriety. And so I knew that was just, these two kids were just the tip of the iceberg. And that's really what sent me on this course to say, how do we get here? And, previous to that, I had read about the scourge of OxyContin, but I didn't really understand how it was addicted to heroin.
What surprised you when you started doing the research for Dopesick? Like, when you really got into it, what was the most surprising thing that you discovered?
Well, I guess it was a surprise. So one of the things I like to do is I like to get really close to the ground level of what's happening, right? So I'm not going to just call the CEO up first. I'm going to start with the people who are most affected. And I've done that for every book. And so I went back to tiny Lee County, Virginia, which is in the coal fields. It's in Appalachia, the central Appalachia. And it was really one of the first places where crime just went crazy because of OxyContin and because of the way Purdue reps, you know, overly targeted these regions that had high instances of workplace injury. And I found the doctor who was the first one to call Purdue and say, look, I know you say your drug is virtually non-addictive, but I've got kids I immunized when they were babies overdosing in the high school library. I've got farmers and miners losing everything. Patients I've known for decades losing everything because of this drug. And these were people who previously had injuries and been able to get off of it. But with OxyContin, it was different because it was such a like nuclear bomb of oxycodone. And he was calling Purdue in order to tell them that, I mean, I've got a letter he wrote to them that said, I fear that we are the sentinel areas in Appalachia, just the way New York and San Francisco were in the early years of HIV. And of course, he was so prescient. Everything he said was right. But the company just wrote him off as a kook. And, you know, he testified before Congress, the FDA. He was out there working so hard. And I guess one of the surprises that when I go back and interview him I think the first time I interviewed him was 2016, I really want to know, how are you now? And how was he now? He was working 16-hour days. He was in his mid-70s. He had more addicted patients than ever, and nobody was still listening to him.
Mm-hmm. Yeah.
And I mean, it gives me goosebumps. He introduced me to a bunch of his patients. I really got to know them. And, you know, early on, one of them says, you know, at the end of your journey, you're not doing it to get high. You're doing it just not to be dope sick. And,
right.
And he said the same thing those kids told me back in Hidden Valley that I had interviewed earlier, the rich kids. You know, like if your dope man's not coming till Monday and you only have this amount of dope to last you through the weekend, you're going to parse it out, because the worst feeling in the world is to be dope sick, this terrible withdrawal. And I thought, if I could just get readers to understand that they're not bad people, that in many cases they were prescribed this initially by a doctor, or they got their hands on it because somebody else was initially prescribed way more than they needed, then that would be a real public service to tell people and to begin to break the stigma, which is still so pervasive.
Yeah, and that's certainly a theme you pick up in Raising Lazarus too, telling the story of, you know, people who are really going against the odds to try to reach people who are living in addiction. Maybe before we get to that, I was going to go back to something you said earlier, thinking about that period where everyone was so slow to realize what was happening. The federal government, public health, you know, what thoughts do you have about that? State government, yeah. What thoughts do you have about that?
Well, when I interviewed Dr. Van Zee, the doctor I was just talking about, I interviewed the health department director for that region in Virginia too. She actually called Richmond, the state capital, very early, because she started seeing these terrible abscesses she had never seen before. And she said, y'all, I think we got an epidemic brewing. And she too was written off. And I also think that the role of the media and the shrinking local news, shrinking regional news. Our paper used to cover all of Western Virginia. Now it barely covers Roanoke City. You know, it's just gotten so small because of the internet and all these other financial factors. And so there weren't people out in the hinterlands, which is where this begins, to really like ring the bell and say, look at this. I mean, there were obviously Dr. Van Zee and Dr. Cantrell that I just talked about, but nobody was really picking up the story. I think Sam Canoni's book came out in Dreamland, came out in 2016, and that was really the first national book.
And that book told an interesting story too about how folks, you know, the nefarious folks kind of understood the epidemic before anybody else did, and really,
you and I may not have known that oxy and heroin were chemical cousins, but the cartels did.
They sure did. So, you know, it's interesting to me, you know, just thinking back to, I just had oral surgery a few weeks ago, and my oral surgeon still offered me oxycodone, you know, and so I think we've come a long way, but I still think we've got a long way to go for people to really understand, what is pain relief, and what's necessary and unnecessary. But let's go back to Raising Lazarus. You really, what I thought was interesting, really two stories. One about folks who are really going out and trying to engage people like Tammy and Michelle Mathis and others. What what kind of drew you to their stories, and what do you see that they kind of had? What's their common thread?
Mm-hmm. Well, when I was finished writing Dopesick, the main person I'd been following was brutally murdered, had been abandoned by every system meant to help her with her OUD, and just couldn't get the right kind of help. And she ends up doing sex work and being homeless, living in an abandoned minivan with a pimp on the streets of Las Vegas, and just a nightmare scenario. And I actually had to rewrite the ending of the book after what happened to her. And I was just like, I never want to write about this again. This is so dark. I never thought I'd be in a funeral home with a mother saying goodbye to her daughter's battered body, and it was just so depressing. And my husband said, you should write a cookbook. Like, you should do something happy next. But as I went out across the country talking about Dopesick, I started to hear these really interesting things that were happening. And they were sort of the answers to what Tess Henry had said when she described how she'd been overprescribed and then she couldn't get care. And she said, what we need, because she'd been overprescribed initially at an urgent care center, she said, what we need is urgent care for the addicted. And so I felt her spirit sort of hanging over me as I was figuring out how to tell this story that would have hope, that would have answers, solutions. And what did Tess mean by urgent care for the addicted? Well, she didn't really know because she'd never had it. I didn't know because even though I'd been all over the place, I hadn't really seen it. I had been to one or two syringe services programs. But then as I started seeing how they were really working on the ground to bring care to the least of us, and going to them exactly where they were, whether it was in a McDonald's parking lot next to a dumpster, whether it was in a syringe services program, in a tent under a bridge, they were really doing the work that our systems hadn't bothered to figure out yet to do. So when you have an 87% treatment gap, that means only 13% of folks getting evidence-based care in the last year, what you're doing isn't working. What we're doing, we have so many barriers, so many structures, so many rules, and people are dying to the tune of 111,000 in the last year. What we're doing isn't working.
Yeah.
So I thought, if I can find these heroes who are, basically with duct tape and glue in their own personal cars, people like Tim Nolan, the nurse practitioner, who's meeting patients in parking lots and just working his tail off, going to people's homes to do hepatitis C testing parties, getting people on low barrier buprenorphine. If they can do that in a state that at the time hadn't even passed the Medicaid expansion and really begin to get people better, like as this money is coming down, I wanted people to know these people have figured it out already. Let's look at what they're doing.
Yeah, I love that part in the book about no vans, right?
No vans. Yeah, it's too like official looking. They will be scared of us if we come out in a white van.
Yeah. Well, and you just talked a little bit about what we're doing is not working, and what really struck me is you really hit over and over again in your book the disparity between what we know, what the evidence tells us, and what treatment looks like. And maybe just want to hear a little bit from your perspective, like, kind of what are your thoughts about that? I'm guessing frustrations.
Mm-hmm. Yeah, frustrations. It is a bit of a learning curve. You got to learn about medication for opioid use disorder, or MAT, medication assisted treatment. We know going back to the 80s that buprenorphine is very efficacious, or Suboxone. There's great research on methadone. We're just not offering them at the scale to match the scale of the crisis. In fact, nowhere near offering it. And we only have 6 to 8% of doctors that even bother to prescribe because they don't want this difficult patient population in their waiting room. I mean, it's sheer stigma. It goes back really when you begin to unpeel the layers of the onion, it goes back to the historically racist war on drugs that was meant by design to disproportionately incarcerate Black and brown people.
Yeah.
And we've all grown up with it, though. We've all grown up with thinking jail should be, these people should go to jail. Well, you know, jail doesn't work. When you get out of jail, if you haven't had treatment, if you don't have a connection to care at that vulnerable moment, you're 40 times more likely to overdose and die if you haven't had any care. So that's why I spent a chapter up in Northern Virginia where there's a sheriff, Stacey Kincaid, working hand in hand with a harm reduction group, so that now she has counselors co-located in the jail. She has nurse practitioners. Every single inmate gets screened for substance use disorders, gets counseling, gets group therapy, gets buprenorphine if they want it. And this was a learning curve because some people are in the jail for illicitly distributing buprenorphine, you know, and that's because it's not available. Here's a sheriff who's an elected official who has a ton of power in the biggest county in Virginia who decides to take a calculated risk that she's going to do this, even though some of her deputies don't want to do it. And she ends up having to fire a couple, you know. That's courage. And that's what's needed, courage and leadership at all levels of government.
And I remember visiting one of our member agencies a few years ago and right after they had introduced buprenorphine as part of their treatment regimen, which was really a new thing. I mean, they were an abstinence-based, treatment organization. And one of the things they talked about is they had to start different NA groups because the folks on buprenorphine weren't welcome necessarily in AA or NA.
Yes, I'm told that's changing, but I saw that firsthand with Tess because I would drive her to her NA meetings that she had to go to as a condition of her bupe, and no one would sponsor her. And she stopped going because that felt like daggers to her. And, I think it's gotten better. I'm told by NA leaders that they're not doing that anymore, but there's still so much stigma. Most rehabs still don't allow it. Many sober living facilities don't allow it.
We put out some guidance a few years ago for sober living to how they could incorporate medication access into their programming, and something that we like to continue to try to work to make sure that folks are accepted anywhere along their recovery journey. You talked a second ago about the sheriff in Fairfax and really embracing harm reduction. Like I remember when I worked for the federal government and we were told we couldn't talk about harm reduction at all. And
I mean, even under Obama, they couldn't even say the word needle exchange.
Yeah. But I think we've come a long way. And you really do a great job in Raising Lazarus of profiling a variety of people around the country who are trying to do syringe exchange or other kinds of harm reduction. And yet so many of them continue to bump up against community opposition, other kinds of problems. Do you have any hope? Like, what do you think is the next frontier in harm reduction, and how do we get there?
Yeah, I think there's a lot of resistance in some quarters of law enforcement, and I can't make people read the book or make them read the data, but when I hear things like the sheriff, not Sheriff Kincaid, obviously, but another sheriff in Virginia of a very large county says, we don't go for that Naxalone, not naloxone, not Narcan. He doesn't even know the word, refuses to let his deputies carry it. I mean, we've got to elect people who bother to read the research about how to fix, the worst drug epidemic in our history. And we've got to hold them to it. We now have 2/3 of American families have been impacted by that. And so frustrated at the beginning of working on this because I was like, do we have to reinvent the wheel in every single locality? Well, the answer is yes.
Well, isn't that the nature of our country, though, right? We don't have national systems. We barely even have state systems, right? So much of it is about, kind of what happens locally, what's available locally.
Yeah, and one uninformed sheriff can do so much damage, but I don't think people realize that. Like, I spend a lot of time down in Mount Airy, North Carolina, which at the time had the second highest overdose rate, and they had this really impactful opioid response director who was former DEA, former Marine, but he had done all of his homework and he couldn't get, like the sheriff wants to build a bigger jail to the tune of 40 million plus. And that's all he cares about. And he tells them, oh yeah, we'll have treatment in the jail with our new jail. And the new jail opens this year and he reneges. And so that's a matter of, we really need to bird dog what's happening because people are dying when they come out of jail. Unlike with Fairfax County, you have worked with your peer recovery coach the whole time you've been in jail. That person's going to pick you up the moment you get out and take you to your next place, which you've prearranged with that peer, and give you Narcan, access to Narcan and buprenorphine, and get you on, a warm handoff. And you see when people start to do these things, the sky doesn't fall, and they get really excited about it. And then they start to help other communities. I write in Lazarus about this emergency department director here in Roanoke, where I live, who just thought buprenorphine was a drug, treating a drug addiction with another drug. It wasn't his job. Then he looks into the data and he says, how can we not be doing this? The evidence is so clear. And so now he's running around teaching other hospitals how to do this, because doctors will hear it better from doctors, right? And judges will hear it better from other judges. And so I really tried to write a book that a community leader can pick up and go, here's how I might make change in my community. It's kind of like a study of how to make change.
Yeah. No, I love that. And, I just keep thinking about this theme of how the war on drugs has kind of been translated into a war on drug users. And if you hear the rhetoric coming out of California, Oregon, other places, it's really, kind of conflating these things. I visited a safe consumption space in San Francisco about a year ago that's subsequently been shut down. And what was really startling was all of these people were using drugs in this exact same location before the safe consumption site was there. And they're still there now. It's just, with the safe consumption site gave them a place where they could be assured that they weren't going to die. And it's just so interesting how politically, it's still so untenable in so many places.
It is. And I just feel like it's just willful not wanting to read the data. We know that people who go to needle exchanges, there's still a lot of places that don't have needle exchange even. And yet we know that people who go to them are 5 times more likely to enter treatment and, way more likely not to spread hepatitis C and HIV. It's just a few counterintuitive steps you've got to get people through. But as you say, when you go and see it for yourself, you go into one of these places and it's like a warm, judgment-free zone where people are met with love and, all of their needs are addressed, whether it's food, housing, it's basic connections to care. But again, it's just not.
But I think that's the part that pisses people off, actually, right? Because there's this part of people's brains that want to be judgmental because they don't understand. I think also, if you read, that these drugs just have such a powerful hold on your brain. And as you talked about, also people not wanting to be Dopesick. I think people just don't grasp how powerful this addiction is.
Yeah. And until they see it firsthand in their own families, when you've already got 2/3 of families, like it's coming.
Yeah. So you talked about how one bad sheriff, do you see any hope, kind of in law enforcement? I know we've done a lot of work trying to promote best practices, but, in any of your travels around the country, discussions, what gives you the most hope around law enforcement?
Yeah, I was given a talk on Monday in Kansas, and there was law enforcement and healthcare providers, and people know what harm reduction is now. That's a good step. People know more about buprenorphine, whereas was it 3 years ago or 2019? I was giving a talk to all the sheriffs in Indiana, and not one person clapped at the end of it.
I remember that story in your book.
Yeah, I mean, dude, these guys all had guns on their waist, and they were just at me. And and I'm told now that almost half of the counties are offering bupe in the jails. The governor had done his homework, and they really pushed it. There's things that can be done with the power of purse to sort of persuade people that this is the way to do it. But I mean, I would just love to see more leadership exacted on every front.
Yeah,
there's so much NIMBYism, and we're so polarized, and the volume has been so turned up. It can be really tough. I mean, even the Chris Atwood Foundation near you guys that works with Sheriff Kincaid, they've got a NIMBY thing going right now, and they're not even doing needles out of the site. They're doing needles in the mobile, but a couple neighbors that are misinformed can ruin everything.
yeah.
So it's the reason I liked writing about Michelle and her wife Karen and the work they're doing in Hickory, North Carolina, is that they really bothered to. Michelle was the only person working in harm reduction that I ever said you have to meet the other side where they are too.
Yeah.
And like, she walked the walk. Like, she walked.
I was
she
really
worked
taken
literally.
by that, right? Yeah.
Yeah, she literally works for law enforcement now. She does one of her many jobs is she does post overdose response for the county where she works, and all the prosecutors know her. So when she has a client who is having trouble with their court fees or something like that, like, she can go and negotiate for them. And oftentimes these harm reduction people who are just operating at the ragged edge of capacity are really the only people who can speak up for this group. I mean, a lot of them are estranged from their families because of behaviors and sad things that have happened and rough things. And yet you have this place where you can go, this urgent care for the addicted, if you will, where somebody can just walk in and get a shoulder to cry on and access to services. I mean, it's life-changing, and you see it. And so that what Michelle does, because she's a Christian minister, is she tries to use the stories of the Bible to persuade so-called Christians that they got a blind spot here, that we've all grown up with this blind spot called the war on drugs. And she takes them back to Lazarus and the story of Jesus raising Lazarus, but it was up to the disciples to unbind him from his burial cloths. And it's hard work, and it's messy and tiring and stinky, but only by getting close do you get to experience the miracle. And I just love it. I was at a public meeting where they were trying to organize transportation for folks who live in the rural countrysides who couldn't get into Mount Airy for their buprenorphine appointments. And the meeting came to a halt when one so-called community leader stood up and said, well, I think when they overdose, we should let them die and take their organs. I mean, whoa.
Yeah.
And Michelle stood up and she said, y'all, do you know the song, They Will Know We Are Christians by Our Love? I'm not feeling it. And then very gently sort of took them through the science and, how to do it differently. And, they're starting to do it.
Yeah. Well,
every person in that county now, if it has an overdose, now gets a call from a peer.
That's incredible.
Every single overdose, it's a response to a peer. There's a peer station in both the hospitals, and the EMS got a grant. They're even doing low barrier in the field of buprenorphine. And that's despite all these hurdles on the judge's side and the law enforcement side. Mark went, he improvised, overcame, adapted. He went and found allies where he could. And I think that's a powerful lesson about how to make change.
Yeah, that's a great one.
Because then you get people that go, oh, wow, we're not responding to the same folks with overdoses every day, because they're getting better. And people like that. People like to think they're making a difference.
Yeah.
And then they teach other people elsewhere how to do it.
Well, so the other story you tell in Raising Lazarus is you kind of follow the Purdue bankruptcy, and I know we're entering another phase of that. Anything you want to say about that story, and as you dug into what shocked you?
Well, again, what's the Margaret Mead quote? Like, the only thing that makes a difference is a group of well-informed
Never
citizens.
doubt. Yes, yeah.
Yeah, it's the only thing in history that's ever made a change. And this group, led by Nan Goldin, the famous photographer who had been addicted to OxyContin after surgery, I spent many meetings with them. They would meet every Thursday at Nan's apartment. And then when COVID happened, they'd meet over Zoom. I'd join them there. And they had this one pro bono lawyer named Mike Quinn, who just spending so much time. And he's basically the only lawyer facing off against an army of lawyers working for Purdue. The top one is making $1,900 an hour. And Mike is filing these fiery briefs, and he's getting the attention of the bankruptcy judge, who can't stand him, judging from some of the stuff he says to him. I mean, he really gives him a scutching numerous times. And then one of the judges in the bankruptcy, in the appeals, actually agrees with Mike. And the trustee's office in the bankruptcy division agrees with Mike. And so now the case is going before the Supreme Court next week.
Next week?
And yeah, and the trustees, or the Solicitor General, is arguing it for the trustees. But Mike filed a brief. He now represents just one client who lost her son. And, you know, they're still out there. And so I followed them because I thought they were fascinating. Why were they doing this? Like, they're spending so much time, they're not being compensated. Like, how do we get to a place where the only people sticking up for this group of 7 million people with opioid use disorder are people working from their duct tape cars and doing pro bono legal work? You know, like, what's that say about America? And I came to the conclusion that, you know, if Purdue is allowed to use this loophole in bankruptcy court to get them out of thousands of civil lawsuits, and with, you know, roughly half of their wealth still intact, which is a lot of wealth, like, what's going to keep another family of millionaires that wants to be billionaires from doing the exact same thing? And I'm really hoping, you know, that the Biden administration and the Supreme Court and the Solicitor General, like, I'm really hoping that they send a message of deterrence, because, you know, we had an opioid crisis in this country in the 1890s, right? After the Civil War, and morphine epidemic, and then heroin was introduced in 1898, and then it was kind of all shut down in the early 1900s. And, you know, from the historians I've interviewed, like, nobody ever expected this would be allowed to happen. But when you watch the Hulu show Dopesick, or you read the books, you see, like, just how diabolically clever they were.
Pain being the fifth vital sign, right? I remember when that happened, and that really changed the dynamic.
Yeah, a lot of hospitals still have those smiley faces. Got to treat your pain, or we might lose our money, you know, our Medicaid reimbursements and whatnot. And you know, the show is really about the case, but it's also really about the victims too, because our hope with the TV show, like, a couple 100,000 people read the book, millions of people watched the TV show. The idea is that teach them that a lot of these folks were initially addicted through no fault of their own, and maybe that will begin to explain who the real criminals are. It's not your cousin who's in jail for a user amount of illicit drugs. It's the people who started this, and then the other companies that took it over when they saw that Purdue was making money hand over fist, and the revolving door, and the lack of regulation, all those things. So my hope really was to, like, that the show would help with the stigma. And also, if you saw, like, an A-list actor like Michael Keaton and his character struggling to get on buprenorphine and methadone, and then he can get better. You know, that's the whole message of Raising Lazarus, is if we don't write these people off, they actually can get better.
Right,
and then they can become like these super powered peer recovery specialists and you know, like the doctor in Dopesick, Dr. Steve Lloyd from Tennessee. His story is the one that the Keaton character is based on. Like, he runs 3 methadone clinics now and is chair of the Tennessee Opioid Abatement Authority. I mean, I've never seen anybody do such a good job as Dr. Steve. He's so passionate about it. He himself was addicted, you know, at one of his lowest points. He, you know, demands surgery that he doesn't need so that he can get opioids, just like the Keaton character did. And because we've got to really put that, and this is why the Supreme Court thing is so important, because we really have to put the onus on the people and show Americans that this is not a driverless car. It's not a perpetratorless crime. Like, somebody did this. We've got the emails they wrote. We've got tons of proof. They pleaded guilty twice in court.
Yeah, and it was amazing how we got the whole federal government apparatus, the FDA. I mean, the FDA was still approving new opioids in 2016. And, you know, I remember having an argument with one of my neighbors who worked at FDA. Like, he was surprised that people were upset about this. Like, you know, it's just amazing. Well, what's the next story you want to tell?
I am actually working on kind of a personal story. I wrote a piece for the New York Times when my mom died in 2020 about how divided families are. So it's really a book about polarization in families, using my own family as a story, but also about how it's really a journey back to my hometown in rural Ohio. All of my books have come out of rural America. So I'm following. I grew up poor, was the first in my family to go to college, and I'm writing about the barriers for people today. And honestly, I was not going to write a third opioid book, and I'm not, but what I'm seeing, and I don't know if y'all have read Demon Copperhead by Barbara Kingsolver. It won Pulitzer last year.
I haven't read it, but so many people have told me I should.
It's so good. It's probably my favorite book ever. And she tells the story from the kids. And that's what I'm seeing in my reporting. I'm seeing suicide, just incredible youth suicide, truancy problems, just so many. I was out with the truancy officer week before last. So many kids living with grandparents because of the opioid crisis and not going to school and being defiant and, you know, going down bad paths. And I feel like my new book is kind of the reality version of Barbara's novel, which was the novel version of Dopesick, right? So I feel like they're all connected, and I'm seeing the issue in a different way that's very worrisome. And but it's also a different kind of style of writing, so I'm really excited to delve into that.
I can't wait to read it when it comes out. And
thank you.
You know, I just want to say thank you for the work that you've done, helping to put in perspective what so many of us have experienced. The work that you're doing to try to break down stigma, to present science in an understandable way. It's so important. Our members who work every day to make recovery and well-being possible, we're so grateful for the work that you do. Thank you so much for joining us for this discussion.
Well, thanks to all your members too, because this, I mean, I was saying this in Kansas this week. This is the hardest work, but it's just so important. And I know there are days where, like, oh, I've seen people just be, you know, worn out from it. But y'all are warriors and heroes for stepping into this. And
I remember certainly are. I am impressed by them every day, every opportunity I have to talk to them, to go out and see them. So thank you for recognizing that as well.
Yes.
All right. Well, thank you all for joining us. That concludes this episode of Wellbeing Wednesday. I hope you enjoyed the discussion with Beth Macy. Be well.